okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD, whether it's for school, homework, or just everyday activities. FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFoco, thinkfoco.com for more information. Welcome to the Your Kids Will Be Fine podcast. I am Dr. Michael Malopsky, board certified pediatrician and parent of 7, now grandparent of 3. On the Your Kids Will Be Fine, we talk about all the areas of parenting and raising kids where we tend to be inundated with more information than we know what to do with, especially in today's social media and information-driven world. And what we try to do is help parents filter through that information, try to understand what's really important, and try to apply that to rational, sustainable parenting choices, and hopefully decrease our anxiety about the parenting choices that we do make. We are available on all podcast platforms. Find us on Apple Podcasts, Spotify, or anywhere else where you find your podcasts. So for the next few weeks, we are going to divide our Your Kids Will Be Fine podcast episodes by ages and stages and talk about the most important and the biggest and most active areas that parents tend to be researching, where there's seems to be a ton of conflicting and confusing information, and hopefully help us filter some of that when it comes to the choices and approaches to parenting that we have. So the next couple of episodes, we are going to be talking about newborns. So let's talk about at least, we're going to go in sequence and talk about some of the parenting decisions and things that we have to think about when we have our newborn in the hospital and the transition to home and the first few weeks at home. So let's start with the first big decision that I think parents are often asked to make. And that is when your baby's delivered, you are often asked two things. One is you're asked about giving a hepatitis B shot and a vitamin K shot, and eye ointment. And you're asked about, if you have a boy, circumcision. So let's take those in order. So first off, vitamin K. Why do we give kids vitamin K? Vitamin K has been offered as a intramuscular injection in the newborn nursery since I believe since the 50s, I think in the 60s. And the reason why is that there are unpredictable events of what we call vitamin K dependent bleeding, both in the early newborn period, which is the first week, and later, which is weeks 2 and 3. The system of vitamin K that helps normally clot blood and regulate bleeding isn't fully formed at birth and takes time to develop. And it starts to be produced in higher levels, usually after the first week of life, naturally, but it's highly variable among individuals. And completely, perfectly healthy kids would have unpredictably devastating episodes of vitamin K dependent bleeding. In the newborn period, in the first few days, it was usually GI bleeding into the bowel. And in the late period, often after the first week of life, it was often bleeding into the brain, which can cause devastating long-term effects and sometimes death. It was not common, but it was present and regularly, predictably present in the population. That essentially ended when we took the stance of giving every newborn a dose of intramuscular vitamin K injection in the newborn nursery. It prevented both early and late vitamin K dependent bleeding. And now I have never seen it in my entire career, except in parents who have refused the vitamin K shot. So there are a couple of issues that have been brought up to me, both from families and I see online, that I want to clear up about vitamin K. Vitamin K has been presented, there's been concerns that it is a cause of long-term blood problems like leukemia. That simply isn't true. All the long-term research that has followed infants who've received vitamin K in the newborn nursery, which is most infants now, and you're talking tens of millions of infants a year who get it. There is no increased rate of leukemia or other bloodborne cancers. There is no increased rate of autism. It's not associated with the rise in autism that we are definitely seeing. And we can talk about that, but that is multifactorial, but has nothing to do with vitamin K. And it doesn't cause any developmental or medical harm. And it can prevent an unpredictable event that's impossible to know which children are going to be affected by it. So when you're deciding what you want to forego and what choice and the choice around vitamin K in the newborn period, the evidence is overwhelming that for the health, safety, and well-being of your newborn baby, it's important to give them vitamin K. The next big decision is the hepatitis B vaccine. Now, the biggest argument I get is that I, as a parent, was tested for hepatitis B, and therefore I know I don't have it, so I'm not going to give it to my baby during delivery, which is the highest risk of transmission because of the exposure to blood. And that my baby is healthy, so why should I give them a hepatitis B vaccine? And all of that is valid. Hepatitis B is a blood-borne viral illness. Most people get it through either medical exposure, meaning blood transfusion, or exposure during severely invasive medical procedures, or IV drug use or sexual contact. So we're not worried that your child is going to be abusing IV drugs or having sexual contact. However, we do want every adult to be protected and vaccinated against hepatitis B. One, because we don't know what choices people will make as adults with regards to sexual health and IV drug abuse. And likewise, we want to protect everybody from an imperfect system, which does screen most of the blood supply for hepatitis B. However, still at times it is imperfect and people can still be exposed through blood products because of a medical condition. So if you know that you're hepatitis B negative, no, there isn't anything wrong with deferring Hep B. It's certainly fine to wait, and certainly you're not causing your baby any harm. However, things unpredictably can occur when you don't expect them to, such as complex medical conditions that can come up in childhood, such as cancer, leukemia, such as a traumatic injury, where your child may need blood products to save their life or prolong their life, in which case you would want them protected against hepatitis B. Those are all rare. I completely understand and acknowledge, but it's offered in the newborn period as a way to make sure that everybody is covered in a timely way should they need that protection. So it's certainly, you're not harming your baby by choosing to defer hepatitis B, but it's important to understand why newborns are offered the hepatitis B vaccine. And then, so the next eye ointment, people always say, well, I tested negative. I don't have any sexually transmitted diseases. Why would I give my child eye ointment since that's what it's for? That is one of the reasons that we give infants and newborns eye ointment. The other reason is that the birth canal, where all babies are born through, is filled with bacteria that's just normally present. Bacteria from the bowel, group B strep, E. coli, that's all present around the birth canal when your child emerges. If those get into their eyes, it can lead to an eye infection. So your child is simply offered eye ointment as a way to prevent that and decrease that rate, not because of the concern around a sexually transmitted disease. So important to understand all three of those things. And fourth, and this only applies if you're a boy, is circumcision. I've done podcasts on circumcisions in the past. Not if you want to understand the details around circumcision, certainly welcome to listen to the Kids Will Be Fine podcast on our website, yourkidswillbefine.com. You can download all the episodes, including the episode on circumcision. The most important things to know is that circumcision is optional. There is no compelling medical reason why anybody has to circumcise their baby. It is strictly personal choice. On the other side of that, circumcision, there is a lot of misinformation that it is unsafe and that the procedure causes lots of long-term psychologic and physiologic harm. And I think that that's simply not true. As someone who's been doing circumcisions for 20 years, if circumcision, when done correctly with someone who's experienced, is minimally painful, takes very little time, it causes no long-term trauma or or medical issues for the infant. And so the point of that is that it's completely fine to say that I don't wish to circumcise my child, and your child will be fine. And if you do choose to pursue circumcision, your child will also be fine. So I think it's important to just be comfortable with either side of that decision and that discussion. So, and then the last part of the major decisions that people will wrestle with and deal with when you deliver a newborn and as you're transitioning your newborn from the hospital to home is how you're going to feed your baby, and breastfeeding versus bottle feeding. So let's talk first about breastfeeding. There is very little debate about the benefits, both short and long term, of breastfeeding, both for the health of the infant and the health of the mother. Breastfed infants have lower rates of allergic and autoimmune issues. Breastfed infants have a better metabolic health compared to non-breastfed infants long term, although those numbers are difficult to tease out exactly where that stands. Breastfed infants have lower rates of certain infections because of the immune benefits of breastfeeding. Breastfed infants have lower rates of sudden unexpected infant death or sudden infant death syndrome. So, and mothers who breastfeed tend to return to their pre-baby weight quicker, have faster recovery. There's lots and lots of undisputed benefits to breastfeeding your baby. That being said, breastfeeding does not always work the way we want it to, and doesn't work the same for every mother, infant, child. There can be lots of issues that affect breastfeeding that make it very difficult. It can be exhausting. There can be medical issues that the mother or the infant goes through in the newborn period that make really difficult to establish healthy breastfeeding. And therefore, your child will need to be fed either partially or fully with infant formula. Infant formula has gone through great changes and great improvements over the last 15 to 20 years. Infant formula now has many of the same components as breast milk that make breast milk beneficial for neurocognitive development, for example, such as omega-3 fatty acids and probiotics for immune support. So the point is that, of course, we want to support and help every mother-infant couple breastfeed to the extent that they're able and want to. However, if it turns out for whatever reasons that a lot of them may be beyond your control, that your infant needs formula, is being fed formula, I can tell you with 100% certainty that your infant will still be okay and will still grow and still thrive. And I think a lot of parents, a lot of mothers especially, view or get this idea that breastfeeding is an all or nothing relationship when it comes to the benefits. And I don't believe that is true. Meaning that even if your baby is able to breastfeed to some degree and get some breast milk, even if it's not enough breast milk to meet all of their caloric needs, they still get many or all of those benefits, even if breast milk is not their exclusive calorie source. So to whatever extent you can offer your child any breast milk, whether it's pumped from a bottle or whether it's nursing directly, even if you have to use other sources of calories like formula, it's still providing all those benefits to your baby, and your baby will be okay. So I think that having a more open and nuanced understanding of breast milk and formula can help lower our anxiety and help us feel less stressed and strained when some of these things occur that may or may not be anything we can control. So on the next podcast about newborns, we're going to talk about the co-sleeping debate. We're going to talk about the decisions to vaccinate. We're going to talk about fevers in babies and how fevers in newborns are different than fevers in older kids. So we're looking forward to seeing you. Please go to our website, yourkidswillbefine.com, where you can access all of our shows, leave suggestions and questions. Also, don't forget our YouTube channel, Your Kids Will Be Fine Podcast. And we're looking forward to seeing you next time.